It is the single deadliest form of cancer.
I had a scan and it clearly showed a tumor on my pancreas.
Mum had started to get increasing symptoms. Not that we knew at the time what that was.
You've got to listen to your bodies. For me, it's feel something, say something, do something.
So I've had a bit of a tough time recently. One of my fondest patients unfortunately passed away due to pancreatic cancer. Now, she died pretty quickly. Through supporting her family through this tough period, I thought to myself, what is the best way I can increase awareness of this condition so everyone knows what to look out for? Please share this video widely, as this could potentially save yours or a loved one's life. So here we go. 5 warning signs of pancreatic cancer you should never ignore. Starting off, and at number 5 is jaundice. Jaundice is when your skin and eyes turn yellow due to a buildup of something in the body called bilirubin. Bilirubin is a substance made by the liver. Jaundice occurs when all of this bile, which usually helps to break down fats in the intestines, can't get there due to a blockage caused by the tumor. This is what leads to it building up in the body, causing the symptoms that we see. You see, studies such as this one here outline how serious jaundice is in pancreatic cancer. The mean survival time shown in this study here shows how patients who had pancreatic cancer who were jaundiced had a really significantly reduced survival time compared to those who didn't have jaundice. This all means is that in all cases, if you do notice unexplained jaundice, it is so important to go and see your health professional so this can be looked into, particularly if you are over 40 years old. Next up, and in number 4 on our list, are changes to your poo. Interestingly, this is actually linked to jaundice. You see, when there's an obstruction in the bile ducts, like what we see in pancreatic cancer, this prevents the bile from flowing into the small intestine. When bile can't reach the intestines, it doesn't end up being eliminated in your poo. You see, bile gives the color in your stools, so when it's no longer there, this can result in that pale or clay-colored stool. You may also notice that you develop some dark urine in addition to these paler stools. One of the challenges about pancreatic cancer is that it can cause a lot of vague and non-specific symptoms that can be hard to pin down a cause for. Statistics show how only 5% of people survive pancreatic cancer for more than 10 years. See, one of the reasons for poor survival rates may be because this form of cancer is usually caught later due to how vague some of the symptoms are. So my main message here, as I go into number 3 on our list, is that if you are having persistent symptoms that are just not clearing up, you should really go and see your doctor. And number 3 on our list is tummy pain or back pain. Not everyone who has pancreatic cancer feels pain, and not every episode of tummy pain or back pain is caused by pancreatic cancer, as there are many things that can also give these symptoms. However, my main point here is that if you are having symptoms that are ongoing, persistent, or that you worry about, please make sure that you see someone. Pancreatic cancer pain typically starts off by coming and going, and then later it progresses to become more constant. This pain is usually felt in the upper belly and can spread to the back. This pain often gets worse when lying down and feels better when standing or bending forward. Pancreatic cancer can occur anywhere on the pancreas. The reason why you commonly get pain in the upper belly in pancreatic cancer is due to its location in your body, in the upper part of your belly. Next up in our list, indigestion. Like before, not all causes of indigestion are due to pancreatic cancer, as there are more common causes of this symptom, but it's important to be aware of persistent symptoms that are still bothering you despite treatment. Studies such as this one here put indigestion high up on the list of common symptoms that we see in patients who have pancreatic cancer. And this is the case in both males and females when we compare it to some of the other symptoms that we see. Last on our list, and at number 1, is unexplained weight loss or a loss of appetite. These are such important signs to be aware of. Now, when I say unexplained, this basically means that you are losing a significant or noticeable amount of weight, but with no lifestyle changes, such as eating less overall calories or increasing your activity levels. Unexplained weight loss is seen in pancreatic cancer because these cancer cells release certain chemicals into the bloodstream that change the way in which food gets converted into energy, which can then lead to weight loss. In addition to all of this, the body's response to all of the cancer cells results in a decreased appetite. So how is this cancer diagnosed? Well, doctors use blood tests and imaging tests like ultrasounds or CT scans to diagnose pancreatic cancer. Blood tests often show high levels of bilirubin or any other markers of jaundice. We see over 10,000 cases of pancreatic cancer each year in the UK. And last year, unfortunately, there were 9,558 deaths from this cancer. 37% of cases are preventable. So, what sort of things can you do to reduce your risk? Well, there are several factors that have been shown to increase your risk of getting pancreatic cancer. Smoking cigarettes has been shown to increase the risk by about 20%. High and uncontrolled blood sugar levels also does. And also, being overweight or obese can increase your risk. Diets that are high in saturated fats and processed meats are also things that can increase your risk. On the other hand, eating a healthy diet rich in fruits, vegetables, whole grains, lean meats, beans, and healthy oils like olive oil and those found in fish, nuts, and seeds can all reduce your risk. Knowing the signs and symptoms of pancreatic cancer, as well as understanding the various risk factors, is crucial in early detection and better outcomes. Make sure to check out some of our other videos that go into some of the important symptoms of cancer that you need to be aware of. As always, please leave a like and subscribe if you found today's video helpful, and leave a comment below if you've learned anything new. And remember, I truly care about your health, and I wish you the very best.